embarrassing. And these are really what women struggle with. And more than 50% of women haven't even discussed this with a doctor. So I'm here to tell you that it's time for a change. So you're going to start living without limits. None of these issues should keep you at home, keep you from doing what you want to do on a daily basis. So just to let you know that you're not alone, this is about overactive bladder and actual fecal incontinence. So 1 in 6 women, you can see this shows right here, that's about 37 million Americans struggle with overactive bladder. And when you look at fecal incontinence, 1 in 12, which is about 20 million Americans. So what exactly does that mean? Well, if you look at what's really common in society that people are easily talk with their doctors about, vision problems, that affects 12 million people. Although that's a big number, look how many more people are affected by overactive bladder and fecal incontinence. Or when you think about asthma, which is a very common issue, that's 17 million, still less than what affects women with overactive bladder and fecal incontinence. So that's just to let you know that you are not alone. It is an issue that's very common and it needs to be addressed. So I ask many providers, the lady is not going to bring it up to you. So you need to bring it up to her because it needs to be addressed. And there's plenty of issues that can be fixed so that your life can have much more quality. So what is normal? What is it? Most importantly is that this is not a normal process of aging. Most women say, oh, I can deal with it. I know it's a part of aging. Well, that's not the truth. You should not have to deal with it. You have frequent accidents. You're getting that have to go now feeling. If you're planning activities around your bathroom, if you're monitoring how much you eat or drink just to control your bladder, using pads or protective garments. So unlike those commercials that say pads are cool, that's what the football players wear. Yeah, they're cool for football players, but they're not cool for us women. So if you're having any of those issues, please feel free to continue to talk with your doctor. And if you don't feel comfortable, come into our office. We'll be happy to talk with you. So if your body is telling you any of these things, then you are definitely having an issue with this. So here's how your bladder works. So your brain tells your bladder that it feels full. It sends, your kidneys actually send that to your bladder. Your bladder feels full. Your brain tells your bladder what to do. So that's normal. So anytime there's a breakdown in this communication, then that's when you can have bladder control issues. Same thing with your bowels. The digestive system pushes your food through down to your intestines. When your intestines, your rectum stimulates full, like the nerves are stimulated, your brain tells you when to go to the bathroom. So like I say, any issues in this breakdown, that's when you're going to have trouble. So what causes incontinence? So daily habits, like what you eat or drink. So if you drink too much caffeinated beverages, that causes your bladder to be overactive. As overactivity happens, that can cause you to have the incontinence, which is just a fancy word to mean you have involuntary loss of urine, which means you lose urine when you don't want to. Certain medications or supplements that you take, reducing physical mobility. So if you have any issues with walking, you can't get to the bathroom quick enough, then you can lose urine and unexpectedly. Pregnancy, childbirth, radiation, pelvic floor, any of those things can lead to you having incontinence. So there's 3 common bladder control problems. It's either stress incontinence, that's the incontinence with activity, cough, sneeze, or leak. There's some urinary retention, which means like your bladder muscle is not squeezing appropriately, so you retain urine, or some overactive bladder issues. So stress incontinence, as we talked about, a little thing can trigger a leak and it's driving me crazy, like a little sneeze and you leak, a little cough and you leak. If you're at your exercise class and you are doing some stair stepping or walking on the treadmill or doing some stair climbing, all of those things can cause you to leak. Urinary retention, as we talked about, weak or dribbling stream, like the urine is just not coming out as it should, or needing to use a catheter. You can't tell if your bladder is full. So if you have too much urine in there and your bladder doesn't squeeze appropriately, but it gets to a certain point that it's overfull, then you're going to have some leaking issues. So urge incontinence. You see these all the time where the lady has her legs crossed. I never drink anything during meetings because I'm afraid I might leak. When ladies come in and I talk with them about that, they say, yeah, I have that issue, but this is what I do. I just don't drink. Well, when you don't drink, you become dehydrated. Your kidneys suffer for that. So you can't not drink in order to control your bladder. So if you're going before you reach the bathroom, you have those frequent leaks after just drinking a small amount of liquids, or you're using pads or protective garments, or that frequent uncontrollable urge, gotta go, going more than 8 times, or waking up at nighttime to go to the bathroom. One time, maybe that's okay around the time that you're supposed to wake up. But if you're waking up all during the night, that is just something that needs to be addressed. So fecal incontinence. So you can have what's called an urge incontinence, where you actually feel like you have to go to the bathroom. And if you don't get there, you may have stool in your pants, or when you don't even feel like you have to go and then you have stool in your pants. That's so embarrassing for women. So those issues they're for certainly not going to want to bring up, but we can help you with those. You don't have to suffer through those. The good treatment is the good thing is that some of these treatments can get you back to living life. I'll never forget, one of my patients I had told me that after we did a procedure on her, she was able to go actually to her relative's house and spend the night, spend the weekends. Up until that time, she had limited even doing that. And that's really sad when you think about what people have to do just to control their issues, because they're so embarrassed to talk about these. So we're going to talk about a few things, how we diagnose these, what are some of the changes that you can make that are okay to make, and it may fix your issues. And if not, there's certain medications that will fix your issues. If that doesn't work, then there's other therapies that will really get you back on life, living your best life without limits. So some of these lifestyle changes could come through your diet, through some exercise or some physical therapy. All of these things we can teach you how to retrain your bladder. So it's all because your bladder's just gotten weakened over time. And it's either that the muscle has gotten weakened and that's where the exercises will help, or that the nerve is no longer stimulating your bladder like it should. And that's where we have other remedies. So some of the oral medications that will help, and they work beautifully, but a lot of times they have some unpleasant side effects, especially as we age and these issues bother us more. These overactive bladder medications can affect us even more with dry mouth, blurry vision, constipation, and some of the new ones that work really, really well for the bladder have some elevated blood pressure issues. So if you already are someone that has blood pressure issues, then this medication may not be the best for you. So it just says, this is really great to know that 72% of people that had started a medication for their bladder stopped within 6 months, mainly because of these side effects. So they felt like, well, if these medications aren't working, that's all that my doctor offered. So I guess I just have to deal with the issue. Well, that's not the truth at all. There are other remedies that we can do, other little procedures that are in-office procedures that can be taken to a little outpatient facility to do that will change your lifestyle and give you back that life that you want to live. So these are what I'm talking about, some of these advanced therapies, and it's what's called an InterStim system. So just to let you know, an InterStim system works like a TENS unit for the bladder. It actually helps pace that nerve, so that nerve tells your bladder what to do, so you can get back control of what's going on with your bladder. Or we can even inject some Botox. So just like Botox helps relax muscles throughout the body, you can also inject Botox into the bladder, and you can relax your bladder there. That way your bladder relaxes, and you can get the right amount of urine that you can store in your bladder to get you to the next time that you can actively be able to void. So this is what the Botox does. It's a temporary treatment for overactive bladder. It's injected into the bladder. It unfortunately does not treat fecal incontinence, and it's something that you have to do every 6 months. And it has a potential, although a low potential, to have self-catheterized, which means you have to put a tiny tube yourself into your bladder to empty your bladder, because if the medication works too well, then your bladder may not squeeze like it needs to for you to even empty it. 51% of patients stopped Botox after 2 treatments because of some of these issues. Just like 72% of people stopped their medications because of those issues, 50% of people stopped their Botox treatments because of some issues. So if you look at some of these other treatments that we do, it's an InterStim treatment. And these are the 2 little batteries. So these are the pacers kind of for your bladder. So it's a little stimulation, a little nerve that goes right between your brain that controls your bladder. So this little stimulator actually controls that nerve, which helps both bladder issues and bowel issues. So we do a little test in the office to see if you get some improvement. And that test can range from 2 days to 2 weeks to see if you actually get some improvement. So this is the test that I was talking about. It's a little thin little wire that's placed in the upper part of the buttocks that actually stimulates that nerve. And you have a little control that you use on the outside, and we test your bladder for 3 to 14 days. Some of these issues with this that you may have is some temporary pain or some discomfort just from having the little procedure done. But the quality of life that the patients have received that I've been doing for, I think, over the past 8 to 10 years, it's been simply incredible. So it's very safe and very effective. Almost 90% of patients have received some long-term success. It's a significant quality of life improvement. And for people that have had issues with their bladder control and their bowel control, they have success that way as well. 76% for bladder. And actually, this is 90% success for stool, which seems to be even more embarrassing with patients. I mean, to think about a stool loss versus a urine loss. I mean, many women can deal a little bit better with wearing a pad for urine loss because they think that's what they're supposed to do. But when it comes to stool, they feel like there's really a bad issue. And just to know that there is a simple outpatient procedure that can give you almost 90% control of your bowels again, not having to wear a pad. I mean, that's incredible. And I can tell you, I do the procedure and it is that effective. So is this therapy for you? So just to think, you may be a good candidate if you're having any issues with your bowel or bladder. If you have significant overactive bladder or urinary retention or fecal incontinence that has not been improved with your lifestyle changes or your oral medications or your previous other treatments that have been tried, this is going to be a treatment option for you. So before we end, I see I have a few questions in there. I would like to thank you all for attending. This is our office number. This is our email. You can shoot us an email if you're interested. We are specialists in the community. We're urogynecologists, board certified in our practice. And we've been doing this procedure for over 10 years and know that it's a tried and true mechanism that will definitely help you get your life back on track and live without limits, as our little blurb said. Okay, so let me see what this first question is. Okay, so let's see. So how long does the relief last? So if we do the procedure for the InterStim where we're controlling overactive bladder, then that procedure can last for up to 10 years. The life of the battery is a 10-year life of the battery. We can, replace that battery. Occasionally we have to replace a lead, but not very often. But those are still, like I say, an easy in and out patient procedure. So you don't have a whole lot of downtime with that procedure. Does this help if you're having problems due to prolapse? So that's why it's a very good time to come into the office and be evaluated by your provider. We would love to see you. If you're having prolapse of the bladder, then usually it would require more of a surgical intervention. But just because you have bladder prolapse doesn't necessarily mean that you're having incontinence that can't be fixed with our InterStim procedure, but that's more of a evaluation that we'd have to do in office. Will I be able to return to work right after? So if we do the test in the office, then that you can definitely go to work the next day. When we do the other little procedure, I tell people maybe a day off from work, if that much, but you could be able to go back immediately, not that same day, but the next day back to work. Let's see what this question is. So what does the stimulation feel like? So I'll tell you, when we're testing in the office, we ask patients to tell us if they feel a tapping sensation, and where you want to stimulate the nerve is usually between the vagina and the rectum, like in the bicycle seat. So that's the area where that nerve controls your bladder. So most people say it feels like a little tapping sensation. Some people say it feels like a little vibration feel. If you feel pain, there's a way for us to change the amount of the stimulation that goes to that particular area. So that's a great thing for your remote control. So once we get everything set, It can be patient driven where you can increase the intensity or decrease the intensity. We know that if the procedure is working, you don't have to feel the sensation of the tapping sensation. As long as your incontinence is improved, that's how we know everything is working. So there's always been a question in the past, could you have an MRI with this? And in the past, we have not been able to, but now we have a new battery and a new lead actually that doesn't exclude you from having an MRI. So that's the latest and greatest that Medtronic has put out, because most women don't come to their doctors until they're aging. And as they're aging, they're having more issues with their back that would require an MRI. So now you can still have an MRI and have the Medtronic InterStim placed as well. And this is a procedure that's covered by insurance. Usually it's completely covered by Medicare. If you have private insurance, it's covered as well. You just may owe your deductible as well as whatever percentage that your insurance doesn't cover. So the overactive bladder, this is the overactive bladder and fecal incontinence, different procedures. It is actually the same procedure that controls both the bladder and the fecal incontinence at the same time, because the same nerve that stimulates the bladder is the same nerve that stimulates the bowel. And it is so important. This is why people don't ask their doctor, because they do feel like this is something that happens as we age, which is completely not the truth. I tell people every day, I have 86, 90-year-old females that walk in the office that aren't wearing pads, that have never had issues with their bowel or their bladder. And I even delve into asking them questions. Are you sure you don't suffer from blah, blah, and blah? No, I don't have any issues with that. So for anyone that tells you, or any doctor that tells you it's a natural part of aging, you can let them know that it's not. And you would like to seek a specialist that takes care of that. And that's where we come in at Acadia Women's Health. You're welcome. I'm glad I made you feel comfortable. It's the biggest thing. That's why we enjoy doing women's health, because we realize there are many issues that women fight with that they don't want to discuss with their doctors because they're too embarrassing. You know, that's some of what we do in our cosmetic practice as well. There's a lot of other issues with the bowel and bladder, with sexual health that can be helped. There's lots of things that we do in our office. So never be embarrassed to ask us any questions. It's all behind closed doors and very private. So these are the 6 questions that I feel like I answered.
There may be a few, Dr. Owens, there may be a few additional questions that are frequently asked questions. I don't know if you have those handy.
So I feel like I reviewed a few of those, Kyle.
Okay.
So is there anything in particular? We talked about what the stimulation felt like, about if insurance would cover, or if an MRI, if we could do an MRI. So those are some of the frequently asked questions. So let's talk a little bit more about the in-office procedure. So let's kind of talk about the evaluation. So what happens when someone comes in the office? So when any woman comes in for her annual exam, whether it's a new patient or a returning patient, we always try to ask them if they're having any issues with their bladder, because as I say, that's not something that they're going to bring up, because most women think it is a normal process of aging. So they don't think that they're having an issue with that. So once we bring it up, or we have them actually just do a questionnaire, then the light bulb really clicks on and we're able to open that door for the conversation. So when they tell us that, then we just have them come back for a new visit for incontinence. We talk strictly about what's going on with them. Like, what do you drink? What have you tried? What do you eat? What is your normal activity? And certain things that we may do that's a little bit more conservative. So if we can modify any of those type of things, then of course that's where we try first. And then if that doesn't work after we see them back for a month, then we offer them medications. If the medications help them, then good, we're good there. And then we see them back regularly, like every 6 months, to make sure they haven't had any change. After that, if the medications aren't working, then that's when we go to what's called our 3rd line therapy, which can either be Botox or an InterStim. And so then we talk about the pluses and minuses of both. I would think the most negative part about the Botox is that if you do Botox and there's just a small chance that you would have to do some catheterization, that's a little tube in your bladder, and you have to have it done every 6 months. So those are probably the negative things of Botox. Outside of that, as long as your insurance covers it and you don't mind coming back in the office 2 times a month, 2 times a year, then that's good. You're golden. And many women like Botox and proceed to do that. Outside of that, if that is not an option for you, then that's when we talk about the InterStim. I think what happens with the InterStim is it gives patients more of a control for themselves, something that they can do on their own if they need to feel more stimulation so they can control it. So if the Botox doesn't work, then there's nothing the patient can do. If the InterStim is not working perfectly, then the patient has more self-control to either turn up the amperage, the stimulation, or turn it down if they're having, any pain. The other thing is it's more of a long-term fix, so it reduces the times that you have to come into the office. It also gives you just your quality of life back without, as I just said, just reiterating, without having to see the doctor more than a few times once we get everything settled. So usually once we put you on the path of the InterStim, we make sure that your insurance covers our in-office test. We do that in-office test, which takes about 15, 20 minutes to set up. We put a little numbing medicine, put a little guide wire in there that stimulates the bladder. You have that for a few days to a few weeks. You see great improvement with that. We schedule the little test in the hospital. Do the procedure in the hospital. You do that. We see you back in 2 weeks. We see you back in 3 months, and then you're on your own unless you're having any other issues. And so then we see you back yearly just to make sure, for your annual exam and to make sure everything is working well with your stimulator. And I think let me go back to a few slides to show you the actual size of that stimulator. Let's see. So these are the actual 2 batteries. One's a rechargeable battery and one actually has a life of its own, so it doesn't have to be recharged. So, and that's the size, and the incision is probably about a 2 to 3, probably a 2.5 inch incision that you put on the upper buttocks and the fatty part. So it's not where you sit. It's underneath your undergarment, so nobody will see it. The battery that you fill can either be this size or that size, that it's right underneath the skin in the fatty area. But like I say, no one can see it underneath your clothes. You can feel it, which is fine, but it doesn't cause you any pain. If it does cause pain, then we just talk about what we need to do to address that. Kyle, can you think of any other questions?
No, I think you covered quite a few of them, and I think one of the important ones that you covered was the in-office procedure that you offer patients that takes a handful of minutes. It's there's no incision. It's a simple little wire placement, and then if it's successful, they can proceed with a permanent implant, which is a procedure outpatient at the hospital that takes about an hour or so to perform. But I think everything you've covered is quite comprehensive, and I think quite a good bit of information, and patients can, if they'd like to schedule a consultation with you, can contact your office on the number you have there at the bottom of the screen, or or they can email that email address, info@acadiawomenshealth.com, or go to your website. But overall, I thought it was an excellent presentation. Thank you very much, Dr. Owens. It's always great to partner with you and to bring education to the patient. So thank you for taking the time to do this. And to everyone that joined us on the call tonight, I greatly appreciate you taking your time to learn more about treatment options and about Dr. Owens and her practice. So
please feel free to call us or email us. We have 4 providers here. We can see you as soon as tomorrow, because I know that this is an issue that truly decreases a woman's quality of life, and we would like to get on it and help you out before 2022 so that you can get things going in the right direction and live a life without limits. And thanks again, guys, for tuning in tonight.
All right, you guys have a great night. Thank you all very much. Take care.
Thanks, Kyle.
Thanks, Dr. Owens.
Merry Christmas, everyone.
Merry Christmas.